Family physicians, we believe, are uniquely positioned to discuss alcohol use with patients. They provide prevention counseling. They can identify concerns early. They connect families to resources even. So by increasing awareness and improving clinical knowledge for them, we can help reduce prenatal alcohol exposure and ensure that individuals living with FASD receive the support that they need in order to thrive.
FASDs are important to address because they affect every part of a person's life. It impacts physical health and learning behavior, relationships, and sometimes just daily functioning. When healthcare professionals are better equipped to identify FASDs early and connect with individuals and the families to provide them the right supports, it can make such a meaningful difference across the lifespan for both the individual diagnosed with FASDs and their support system and their families. Family physicians are so uniquely positioned that they can often follow individuals and families across the entire lifespan. One of the key parts that we're working on this year and next year actually focuses on transition from adolescence to adulthood, which can be challenging for both patients and their families and the care teams. And by creating these resources, we're able to better fit real world clinical practice. And we want to strengthen the primary care role.
We lead the space for continuing medical education for doctors, but what we try to do with this project is to dive a little bit deeper. What do they actually need in the clinical care room? And so that's point of care resources or practical tools that we've developed. And one resource I frequently recommend is the AAFP's free online fetal alcohol spectrum disorder CME course. It's such a good product. Like I said, it's free, it's accessible, it's very comprehensive, and we can improve outcomes for both patients and their families.
We provided a lot of the background knowledge for our physicians, like what is fetal alcohol spectrum disorders and how do you identify it? What does that look like? But we really want to dive into what do you do now? Like you have the education, you know what it is, and you've provided the diagnosis to the family, but how do you actually support that family? What does that look like? And this year we are working on a visual aid, and then we're also building out some patient-facing resources to you have now been given a fetal alcohol spectrum disorders diagnosis. What can you do next?
I would say I'm most proud of the AAFP's commitment to collaboration. So, through that national partner network, we've been able to build relationships there. We extend far beyond a single organization, and we can create resources together that are stronger because it reflects multiple perspectives and areas of expertise.
That's what I'm proud of is that AAFP pushes so hard to make sure our physicians have the evidence-based information that they need and that we are able to connect with our physicians directly to provide that and really get that real world feedback. So we work with directly with our physicians, of course, and just hearing from them, I didn't know about this, and now because of this project or the information we provided, they've been able to expand their knowledge set.
Yeah, one standout moment was attending the CDC partner meeting and seeing representatives from across that network. Those conversations reinforced the power of partnership for me, and they demonstrated how much progress can be made and has been made when working together with a shared vision of improving outcomes for individuals and families affected by FASD.
Coming together and having our NPN partners make such a difference from like a personal level. It's very motivating and reinforcing. We work in public health. We are doing work. We see the impact. We know how we are supporting our families, but knowing that you have, your professional community around you to really lean against and collaborate with and come together, it's just been a wonderful additional bonus that I feel very lucky to have been part of.
I look at it as a multidisciplinary approach that helps us avoid working in silos. It encourages us to be more innovative in our work, and it allows for successful ideas and resources to spread much more quickly than if any one organization could achieve on their own.
From like a personal social side, it's been very rewarding to get to know other people who are very passionate about this work and making sure that we're leaving the world a better place than we found it, whatever that looks like. And yeah, it's been fantastic. I've really enjoyed it.